Hello everyone, Tenhundfeld, nurse practitioner, health and wellness expert, coming to you to talk about fat. What is fat? Everybody gets concerned about how this fat management situation goes. We're talking about Ozempic and semaglutide and all these other GLP-1s, and we're kind of going through, how do I get myself healthy? Well, the way I look at fat is that fat is inflammation. We all have a certain degree of fat and we all have a certain degree of inflammation. In fact, the more subcutaneous tissue you have, the more likely you are to have inflammation, meaning your CRP numbers will be up or elevated, or your white count might be falsely elevated because of the general inflammation. You might experience it in joint aches and pains, or maybe even neuroinflammation where you're irritated for no reason whatsoever, or your sleep is poor. There's a lot of reasons that we can have inflammation, but it sometimes comes down to the amount of subcutaneous tissue we have. Well, let's talk about how to really manage subcutaneous tissue. Number one, your liver is the process of glyconeogenesis, which means it's the liver's job to break down fat and use it as energy. When we break down fat, we convert it into basically sugar, and that's through the process called glyconeogenesis. The only way for your body to break down fat is if you stop bringing in sugar and you cause it to need that fat or that sugar. And how do we make our bodies need sugar? We build muscle. And this goes back to my other concept that muscle is medicine. What is muscle and what is it doing for you? When you build muscle, when you strap yourself with muscle, you are basically producing a whole new organ system that is so powerful and so wonderful that you begin to come alive again. It helps your endocrine system, your hormone system, your mental health, your cardiovascular health. Every single system works better when your muscle levels go up. In fact, the more muscle you have, the more reduction you have in all-cause mortality, meaning you're less likely to die of stupid stuff instead of long age or healthy long age. So what I'm saying to you now is that if you want to manage your extra weight or extra inflammation or extra disease process or extra concerns about dying from something stupid, I want you to stay away from simple carbohydrates, your pastas, your bread, your pizzas, your beer, your sugar, candy, all that stuff that they're trying to feed to us on every single corner. At the same time, go to the gym. Start building healthy muscle. And if you don't know how to do that, then you're worth hiring a trainer. Hire a really good trainer that's going to motivate you to build muscle. Some tricks to that is basically start lifting weights in all the directions possible, using a mild weight, but lift it to failure. Do it many, many times until you can't do it anymore. And then set that weight down for 3 minutes, and then do that again. Lift and lift and lift until failure, and you start building muscle. And again, the more muscle you have, the more you're gonna suck down that sugar, and you're gonna start burning that fat. But remember, you gotta stop bringing in sugar. The more you do a high protein diet, a quality high protein whole food diet, and the less you stay away from carbohydrates, you're gonna drop weight like a rock. And so that's my important